Hello, everybody. It is 4 p.m. Time for our COVID update. Some good news, and remembering that we're going to get through this and we're going to get through it together. Want to just start out. Morehead State Eagles are our only Kentucky team in the NCAA tournament this year, so I hope we are all rooting for them in each and every game. Good luck to them. I know that they will make us proud. Let's start today with good news, and we're going to move fast because there's so much today. Today, I'm happy to welcome a new company to Kentucky that's creating high-quality job opportunities for our residents. Metalco, Inc. is establishing its first facility in our state, an operation that will produce aluminum and will be known as Metalco Kentucky, LLC. Located in Franklin, this project will create 60 quality job opportunities for Kentuckians with a $53.5 million investment. Metalco is based in Ontario, Canada, and has established itself as a major producer of aluminum for building and construction, automotive, truck and trailer, industrial, and distribution, as well as a primary recycler for aluminum scrap. The company's presence in Kentucky is going to add to our expanding aluminum-related and primary metal sectors, and it positions the company for long-term growth to support new and existing customers throughout the Midwest. Company leaders expect the facility to be fully operational in 2022, with a capacity to produce 270 million pounds of aluminum every single year. The project is also breathing new life in an existing facility in Simpson County, with the renovation of a 461,000 square foot building that provides an opportunity for future growth. Currently, more than 230 primary metal facilities operate in our state, employing 26,000 Kentuckians. Aluminum-related businesses alone have announced more than 620 jobs and over $625 million in new investment in just the last 2 years. This is substantial growth and highlights our state's ability to support this rapidly expanding industry. Thank you to Metalco for its commitment to the Commonwealth, and welcome to Kentucky. We look forward to helping you grow, and we know that our success is your success, and your success is our success. We're proud to partner with you as a part of Team Kentucky in building a better Kentucky. All right, next one is pretty special. I'd like to congratulate a company that is literally helping build Kentucky and making our economy stronger than ever. Toyota and the workforce at Toyota Motor Manufacturing Kentucky, the plant in Georgetown, this week hit a milestone when their 13 millionth vehicle rolled off their assembly line. It was a bright blue RAV4 hybrid, which is a top-selling model, and here is a picture of it. This is a proud accomplishment for the company and its employees and all the supplier facilities in Kentucky and overall. As many of you know, Toyota has been an integral part of Kentucky's success story since before it began production in 1988. We cannot overstate the importance of Toyota's Georgetown campus for Kentucky's economy, for employment, for workforce training, and for quality wages. The 1,300-acre Georgetown campus is Toyota's first plant in North America, represented an $8 billion investment overall, and it employs over 10,000 Kentuckians. It's also home to a powertrain facility on track to reach its own milestone this year, producing its 13 millionth engine. Further, the massive supply chain for parts and services that Toyota has brought with it over the past 35 or so years supports tens of thousands of jobs in communities all across our great state. Since 2017, Toyota's invested over $1.5 billion in that Georgetown plant, preparing to launch new vehicles, including the RAV4 hybrid. I'm proud to say the company is looking towards the future of transportation. I want to thank Toyota Kentucky for recognizing both milestones through its commitment of $1.3 million to further STEM education and workforce development programs across the Commonwealth. These funds will engage diverse and under-resourced youth by exposing them to great manufacturing careers. We deeply appreciate Toyota's long-standing relationship with Kentucky. It's one we want to continue to foster and help grow. So Toyota Kentucky, congratulations on that 13th millionth vehicle. We are so proud of your work and to be a part of it. All right. Also happy today to announce it's going to be a little bit easier for some people to get their vaccine in a couple of ways. First, we're happy to report that 3 additional transportation providers have been added to offer rides to and from vaccination sites. The 3 new providers are the City of Scottsville offering Scottsville Transit, the City of Owensboro using the Owensboro Transit System, and the Murray-Callaway Transit Authority serving Callaway County. Remember, if you need help with transportation to a COVID-19 vaccine appointment, transit agencies in over 90 counties are offering free or reduced transportation. Kentuckians can find vaccine and transportation services near them by going to kycovid19.ky.gov for a list of participating public transit agencies and phone numbers. Again, thank you to those 3 cities and 1 county for making it easier for your citizens to get vaccinated. We'll have 1 other or 2 other vaccination announcements, but first, the 2020 federal income tax filing deadline for individuals has been extended now to Monday, May 17th. Today, I directed the Kentucky Department of Revenue to extend the 2020 Kentucky individual tax filing deadline from April 15th, 2021 to May 17th, 2021. We're extending the deadline without penalties and interest regardless of the amount. The relief does not apply to 2021 estimated tax payments that are due on April 15th, 2021. It does not apply to corporation income tax, limited liability entity tax, withholding tax, sales and use tax, or other types of state taxes. The decision mirrors the federal individual income tax relief provision issued March 17th by the IRS in response to the coronavirus. The state tax filing deadlines for corporations and pass-through income tax, like LLET returns, remains Thursday, April 15th. Individual taxpayers unable to meet the May 17th return filing deadline may request an automatic extension to file calendar year returns by October the 15th. All right. Next up, because of the positive developments in the downward movement of our cases in Kentucky, because of a positivity rate we'll talk about today that's the lowest since July, we are altering restaurant and bar hours by extending the curfew starting on Friday. At that point, bars and restaurants can serve until midnight, and doors must close by 1 a.m. Now, a couple of things. The capacity is still at 60%, and the seat rule still applies. We cannot have people crowding around bars or in restaurants around bars. We do have to keep people separated. We do need to keep people wearing masks. The mask mandate is still in effect. But hopefully this is a little bit of relief given the positive movement of where we are right now as a state with vaccines going up and cases going down. But let's not mess this up. With 2 months and a couple weeks until everybody who wants a vaccine, every adult gets it, let's not mess this up. Please be responsible. Other good vaccine news, let's look at the number of people vaccinated to date. Table 1 shows us that between the state and the federal programs, we are now at 1,082,303 individuals having at least one, their first shot of hope. Remember, we passed 1 million on Monday, which means we've already done 82,303 individuals since then. Obviously, our vaccine weeks are a little different because they start on Tuesdays, because that's when we get the new vaccine. But if we can show that, what you'll see is just since Tuesday, on which for the state program we received 108,170 doses, we've already vaccinated half. We've already used half of those, vaccinating 54,535 people. That is great. And it means we're going to go through all of this, but we got to keep it up. And every area has to keep it up, which means everybody that has not been vaccinated, we need you to get vaccinated. So let's talk about how we're going to do that. Beginning Monday, we are asking vaccine providers to further open up priority group 1C to all Kentuckians 50 years or older. Remember, right now, 1C is Kentuckians 60 and older that have at-risk conditions that make them at risk to COVID as defined by the CDC, essential workers, and some others. Now, we are opening this up to all Kentuckians 50 and older as well. You will be able to start signing up. You can start signing up for any appointment beginning Monday or later right now. And you can also check with vaccine providers that are working through the weekend, because if they have any excess capacity, they can and they should come down a group to get you or anybody else to make sure they get all of their vaccine used every week, in the very least, beating that 90% goal of 90% of first doses getting in people's arms each and every week. All those deemed in the highest in the most at need should still get priority. So like our oldest Kentuckians. But we can't have these things sitting in the freezer. We are in a race against these variants, and we got to get it out fast. Second major announcement today is we are committing to opening up vaccine eligibility to everyone 16 years and older by April 12th. That is the drop dead date for when we expect to open vaccine eligibility for everybody. And that tails into 3 new sites we have today that at least one is timed to coincide with that. So today, I'm excited to announce 3 regional vaccine sites to help Kentuckians receive their shot of hope. They're going to go a long way in helping us get to our current 108,000, 120,000 doses a week we get, to reach that ability to provide 200,000 plus near the end of this month, and especially through April and May. This brings us to 570 vaccine sites around the Commonwealth that'll help us get a shot in every adult's arm that wants one by May 31st. Our new sites are going to include U of L Cardinal Stadium in Louisville, Whitney Young Elementary School in Louisville's Shawnee neighborhood, and Kentucky Dam Village State Resort Park in Gilbertsville in Marshall County. Let's start with U of L Cardinal Stadium. That site is going to soft launch on April the 8th and fully launch the week after, and it will become very quickly Kentucky's largest COVID vaccination site. It's going to operate in the stadium's purple lot, and it's going to open up 24 lanes. That's right, 24 to vaccinate individuals all at the same time, 24 lanes of traffic going through. The site's going to be ready to vaccinate up to 4,000 Kentuckians every day, as long as the vaccine supply can support that. The location was chosen because of available space, ease of access to Interstate 64 and 265, proximity to the medically underserved, and Kentucky's underserved neighborhoods around it. And remember, to reach the percentage of vaccine allocation of 200,000 plus, we do need more locations and more volume in our largest county and in our largest city. Vaccine appointments for the U of L Cardinal Stadium site will open March 31st. So we'll be talking about it a lot, and those will be for appointments starting April 12th. Scheduling vaccinations at the stadium will be available through the number that's on here, but we're going to come back and talk about it long before March 31st. Kentuckians can access other U of L Health vaccine sites, and that's what I should mention. This is a partnership with U of L Health. They have stepped up. They're going to be running the largest site in the entire Commonwealth, and we appreciate all of their effort and ability to do this. So there's some other good news. Also in Jefferson County, through a partnership with Humana and Norton Healthcare, a new vaccination location will be opened up at Whitney Young Elementary School in West Louisville to serve those who live in or near the Shawnee neighborhood. The site will help advance our commitment to address health equity with intentional, purposeful distribution of the COVID-19 vaccine. The site will be able to administer 400 to 500 doses per day, and it'll add up to 2,000 to 2,500 doses per week, available especially to West Louisville community members. The site will be open 5 days a week initially. Right now, it looks like the site will be open Wednesday through Sunday, subject to adjustment. It will operate with evening hours on the weekdays, and it will remain open as long as it takes to get everybody vaccinated. Starting today, individuals who live in West Louisville can go to nortonhealthcare.com to register for vaccinations that open up April 1st at this location. The site will operate 6 days a week with no Sunday appointments. It'll remain open as long as there is demand. All individuals who get their first shot at this location can get an appointment for the second shot before they leave. Kentuckians wanting an appointment can go to the appointment website. Once there, click Join Waitlist. And as appointments become available, individuals will receive an email with a personalized scheduling link. Also, for people who need assistance with the registration process, Humana and Norton will soon announce a toll-free number to call to make appointments. Again, this number will be intended for use of the underserved community in West Louisville, where vaccination rates are lower than in other areas of Metro Louisville. And finally, we're also working with the University of Kentucky, the local health department serving Marshall County, and Wild Health, a local Kentucky health consultancy, to support mobile vaccination efforts at the Kentucky Dam Village State Resort Park. Vaccinations, which will be the Pfizer vaccine, will be given at the Kentucky Dam Village Convention Center from 8 a.m. to 7 p.m. Central Time, 7 days a week. This will start March 24th, so this one is right around the corner. The sign up is right there, kyvax.com/KYDAM. To schedule an appointment at the Kentucky Dam Village State Resort Park, call 859-217-4679. I believe that we have, for our partners in Marshall County, a short video talking about how ready they are and how excited they are.
On behalf of the Marshall County Health Department, our Board of Health, and the citizens of Marshall County, I would like to say thank you to Governor Beshear and to Commissioner Stack. We're excited to enter this partnership with Wild Health as we seek to provide every opportunity for the citizens of Marshall County to get a vaccination. The limited supply of the vaccine has been the single largest barrier we faced as we've attempted to do everything within our power to make vaccinations available to everyone in Marshall County. So it's with great pleasure that we enter this agreement, and we look forward to making vaccinations available to everyone in our community.
COVID-19 testing at the Marshall County Health Department Wild Health vaccination site will also be offered at no charge in partnership with the University of Kentucky. So now we have 570 vaccine sites, including 61 regional sites, 40 Kroger locations, 45 Walmart locations, 215 pharmacy locations, and our 61 local health departments and several federally qualified health centers. So let's go through the latest maps to illustrate how we are getting COVID-19 vaccines to all Kentuckians. All right, I'll bring it back. All right, we do not have the maps. We'll call that a Kenneth, and we'll move on. To find a vaccine site near you and sign up for an appointment, head to vaccine.ky.gov or call 855-598-2246. If you're looking for more information, you can always get it at kycovid19.ky.gov. All right, I told you there's a lot today, and we're trying to move through it as quickly as we can to get you all the information and then to take questions. All right, today's COVID report, 785 new cases of COVID-19. Our hospitalization, ICU, and ventilators are all fairly stable, up or down, just a handful. Our positivity rate today, 3.23%, the lowest since July the 3rd. That's why we feel comfortable in extending the curfew for restaurants and bars by an hour. And again, as we move forward, if things keep getting better, we'll incrementally loosen. But we got to be careful with just 2 months and a couple weeks to go that we don't get reckless. We also have 31 new deaths today. They include 12 individuals from Boone County, women aged 80, 81, 83, 90, 90, 91, 94, 94, and 103. And some of those are a bit more historic, but they have all come up through the local health department system. Men in Boone County ages 80, 86, and 90. 2 women in Campbell County, we lost ages 84 and 90. 73-year-old woman in Harlan, a 94-year-old woman in Henry, a 77-year-old woman in Hickman, a 69-year-old woman in Hopkins, a 97-year-old woman in Jefferson, a 98-year-old woman and a 72-year-old man, both from Kenton County, an 86-year-old woman from LaRue, a 69-year-old woman from Laurel, a 67-year-old woman from McCracken, an 80-year-old man from McCreary, a 93-year-old woman from Marshall, a 67-year-old man from Ohio, a 57-year-old man from Pike, a 79-year-old man from Pulaski, a 79-year-old man from Shelby, and a 75-year-old man from Trumbull. Also today, we have finished at least our first audit of deaths in Kentucky from the period in which we saw the most significant surge that we've seen in Kentucky, and by a lot. That was a surge between November and the end of January, where we saw more cases than ever in the course of this pandemic, and we have seen more death result from it. So the way that we normally get our death information is through local health departments. We then check the information. We ensure that it is a COVID death. It goes through a committee, and then it moves on to our report. That's why sometimes local health departments will have something earlier than we do. There are some that we receive that we determine are not a COVID death. Our commitment is first to be accurate, but second, to make sure that there are no unknown soldiers, that we account for every single individual we've lost. We recognize every single grieving family. So what we have done is we've pulled every death certificate from that November to the end of January period that lists COVID. We have then compared it to what we have reported, what came up from the local health departments. For those that we don't have a report in, we then see if there is a positive COVID test that we can connect it to. With those where you know that the individual had it, we then look at the documentation in the same way that we would if it came up through the local health department. When they conducted this same type of audit and reported on February 10th, Ohio reported 4,000 additional deaths. When Indiana did it, they issued it on February 3rd, listing 1,507 deaths. Today, we believe that our initial number of additional deaths that are going to come out in the next 3 days will be 604 additional Kentuckians who have passed away from COVID-19 during that period of time, but had not been reported up or hadn't reached us yet through the process through local health departments. That doesn't mean they won't come up in the future, and they'll have already been reported, so they won't appear on our sheets. Today, in what will be included in our report are 417 of these 604. The next 187 will come in the coming days. You'll see in our 417 today, 200 were people in long-term care. And it shows you how devastating this was for residents of long-term care, but it also shows you how these vaccines are working, in that such a small percentage since the vaccination program has started of our deaths are long-term care compared to what we saw in the past. I have a breakdown by county here today of these 417. 103 of them are from Jefferson. 16 are from McCracken. 12 are from Boyle. 12 are from Bullitt. 10 are from Knox. 10 are from Whitley. 9 are from Boyd and Kenton and Madison. 8 in Fayette and Greenup. 7 in Barron, Estill, Floyd, and Hardin, 6 in Campbell, Christian, Laurel, Pike, and Warren. And then every other county has 5 or less. There are 90 counties represented with at least one additional death discovered through this audit. Again, our commitment is to know the full devastation of this virus. And this won't be the last audit that we do. It won't be the last time that we discover additional people who have passed away. Ohio said the same, Indiana said the same. And we have still from this audit a number of records that we still need to get to determine whether additional COVID deaths occurred. And what we will do is we will update when we get the information to make sure that everybody's loss is counted. And that as we move out of this, that we're able to process the total toll that it's taken and the grief that it is created. No unknown soldiers, everybody counts. And we're going to make sure everybody's counted. And my belief is it'll probably take a decade after something like this. And many states are doing what we're doing. Some haven't even started it to know the full devastation. My hope is that people approach it with transparency. That's what we're doing. And again, the value not being any type of ranking that's out there, but the recognition that we've lost so much through the darkest time of certainly of my life and of most of our lifetimes. It'll take us years to process what we have been through, but to do that and to try to find some amount of peace with the death and the devastation that have been caused requires us to acknowledge how significant it has been. So just in a show of how much long-term care has changed, because 200 individuals represented there. Today's long-term care report, just 2 new residents testing positive, 3 new staff members testing positive, 1 new death. So vaccines work. They work. And for anybody out there who's kind of wondering, since it's warmer and other people are getting vaccinated, if you need to, I mean, just look at this additional death toll. I mean, we're gonna surpass by the time it's over 6,000 Kentuckians. And I will tell you that's a lot smaller than the initial projections that I got, suggesting we could lose up to 80,000 Kentuckians. 6,000 is a lot of people, a lot of families, and it means every community has been impacted. Please get your shot of hope when your turn comes. We talk about living for each other. We talk about loving our neighbor as ourselves. If we want to reach herd immunity, and that protects our neighbors, we need everybody to get out there and to get vaccinated. We'll now go to Amy Cubbage for a UI update.
We're pleased to announce for everyone today that tomorrow our new UI login and home screen will go active. It's got a new look and feel, and it will hopefully be both more user-friendly and more secure. If we can go ahead and put up the first slide. This is what the new home screen is going to look like once you get to the Office of Unemployment Insurance page. Especially now at the beginning, since we're rolling it out, you can see there are some tips there at the beginning, including if you are new to the internet, if you are using a public computer, and if you've got privacy concerns, particularly since very sensitive information is put into your unemployment claim. Now, the first time that you log in to this new interface, you're going to have to go up to the top and hit login. And if we can go to slide 2, it's going to take you to a separate login screen that looks like this. And about halfway down, there's a place that says, "Don't have an account. Click here to register." And that's where you're going to click to create this new account that you're going to use to get into the site. All users will need to do this, and it will force you to use a more complex password like most modern websites require. Now, once you get fully logged in, we can go on to slide 3. You will see an interface like this, and hopefully this will help you get through the claims process a little bit easier and with fewer mistakes. You can see there's a button to file a new claim. to request payment, to manage your account, to view your payment history. There's going to be hopefully more accessible information for you. The kcc.ky.gov homepage will have more information tonight, as well as a tutorial video about the new registration process. So please check that out. And again, this is a way to make not just this more user-friendly, but more safe and secure. Next thing, hopefully everyone saw that last Friday, the governor signed Senate Bill 7. This allows us to now waive some of the overpayments for the federal programs like PUA and the FPUC supplement that have been in place in various forms since the beginning of the pandemic. Unemployment insurance claimants who have been notified that they were overpaid will be allowed to appeal those overpayments. If they're not if you did not get the overpayment turned over on appeal, you can seek a waiver. The bill gives us 30 days to send you information about how to do that, and the Office of Unemployment Insurance is in the process of getting that ready. So if you have an overpayment that is now final, that has either been appealed and you lost, or you didn't get a chance to appeal, you'll have an opportunity now to ask for that waiver. For anyone who still has those Bank of America cards that we've talked about for the last 2 months, again, no more money was deposited on those after January 31st, but we have gotten an extra month for you to spend off the money on those. You now have until March 31st. After that, we will have to send you a check, even if you just have 1 cent on that debit card. We have 500 or so people who have a penny left on those debit cards. We've got another 600 who have 2 cents. We've got close to 40,000 who have less than $1. So if you have these small amounts, we understand it's difficult to spend those off, but it will probably be easier for you if you do. But we will be checking again all of these for fraud, and then any that are not spent off by March 31st, we will send you a paper check. Please don't get confused. If you get this paper check for a penny, it is most likely the unspent amount from your Bank of America card and not a screw up with your benefits that you may be getting by a paper check. The last note I want to make, the governor announced the change in both the IRS and the state filing deadline for taxes. I'm starting to see some anecdotal reports that, at least at the federal level, they're having a little trouble processing the waiver of the first $10,200 of your unemployment benefits being subject to tax. So if you have not yet filed your taxes, you may want to hold up a week or two while those kinks get worked out on the federal end. I think that they're not screwing up your return once it's filed. They're simply rejecting the returns right now. So you might want to hold those for a little bit before you file that return so you don't end up with a rejected return. And that's it for today.
Thank you, Amy. Also, thank you, Bruce Maples, for sending a message that is absolutely correct. Morehead State is the only Kentucky team in the men's NCAA tournament. UK and U of L are in the women's tournament. We wish them the absolute best. We are excited about their opportunities, and I hope they know, as their governor, I am fully supportive. So go Cats, go Cards, go Eagles. We want to support all of you, and we are so proud of you. All right, let's open it up to questions. Alex Akisto from the Lexington Herald-Leader.
Hi, Governor. So separate from the audit that you just announced and the additional deaths that came from that, we have known that each day you report new deaths. Not all of those are new. Sometimes those are from weeks, if not months in the past. With the result of the 604 additional deaths over the last 4 months that you just reported, we also know that the daily reported deaths now, since November, have not been a true representation of the day-to-day death toll. Do you think it's necessary, all of this information, considered that your office begin clarifying each day with which deaths are new and which are weeks, if not months old? And if not, do you think it's misleading not to do that?
Alex, we've sent out every time it's been requested the dates of deaths. They was asked different points from the courier, and then I think we sent it to WFPL a couple times. We've provided that information each and every time. We're trying to be accurate, and if we have to take our time, first of all, in when we get them. Obviously, we can't report a death as an official COVID death from the state until we get the information. We also can't report it until we have the sufficient documentation. I know you all remember us being questioned in testimony repeatedly about whether or not we were calling something a COVID death that was a car wreck. And over and over and over, we had to say, no, we go through this process to ensure each and every one of them. That's all we're trying to do here. We want to give the most accurate picture we can. We're happy to send you and anybody else who'd like the actual dates that deaths occurred. Certainly some of them today were older. Now, we think we will see less of that because our older deaths are due to two things. One, us getting it later from another entity, or two, not having the documentation needed and waiting on it to say this is a COVID death. Now, with this audit and with us going out and looking at each of those death certificates before it comes up from a health department, there should be fewer historic ones coming in the future because we'll have grabbed those through a different process. It'll also mean after the audit and after other audits that we do, we'll be reporting less deaths moving into the future. But we've strived from the beginning to be transparent with the information and for it to be accurate in every way. That includes making sure that we check each one of these, that it is a real COVID death. Stu Johnson from WEKU.
Hi, Governor, and thank you. You've been asked previously by Corinne Boyer at our radio about persons with intellectual and developmental disabilities and if they've been moved up on the priority list. My question is, have those Kentuckians been moved up? And if so, why? And if not, why? What's the status, I guess?
So after that question was asked last time, there was even an internal disagreement with whether these individuals are in 1C. They certainly need to be prioritized, and we'll be providing clarity on that shortly. Chad Hedrick, WKYT. Are we missing Chad?
Hi there, Governor. Can you hear me?
Yes.
Wanted to see if there's anything new that you can release on the variant that was announced the other day in Eastern Kentucky, and also if you can release the facility where this has been detected.
Do we have Dr. Stack on the line for questions? Let's go to Dr. Stack to give an update on that outbreak.
Thank you, Governor. I'm just going to clarify on the variant topic. What we found is there's a cluster of individuals who have COVID infection at a nursing home. Because there were vaccinated individuals in that cluster, that triggers the process we have in place to sequence those individuals so we can see if they have an infection that is one of the variants of concern. That terminology, variant of concern, is a terminology that is used by the World Health Organization and the Centers for Disease Control to identify and flag for the international and national community specific strains that have been demonstrated to cause problems. And the most common ones people are aware of are the ones that we associate as originating in the United Kingdom, South Africa, and also Brazil. This particular infection, that is the outbreak at this nursing home, is not one of those known variants of concern. The initial analysis from the sequencing suggests that they are all the same infection, or so similar that they look to be the same. And so they are doing analysis on it and using the data in much larger data sets. We're public health labs report to, and also I think now more commercial labs, to do an analysis. That analysis will help us determine in the future if this is part of a new strain or a new variant of concern, but we're not at that point yet. That's bioinformaticists who have to now work and do this more extensive analysis and determine that. The point we wanted to make, and I want to thank the reporters who covered this, at least locally in my community, was that the vaccines appear to be working. They have reduced the number of people who've gone to the hospital and greatly reduced the number of people who have had any symptoms. So the vaccines are working, and we need more people to get vaccinated as quickly as they have the opportunity, because that is how we prevent more variants and more mutations from occurring. That's how we prevent ourselves from getting into more trouble when we are on the very precipice of hopefully being able to put the worst part of this pandemic in the rearview mirror. So please get vaccinated to help us avert more variants, and please wear your mask and socially distance until everyone has had a chance to get their vaccination, to get their shot of hope, to keep everyone safe. So I hope that helps to clarify a bit. And as far as the specific name of the nursing home, we have generally not released specific nursing home or hospital facility names associated with this out of respect for the privacy of the individuals involved. And unless I'd probably prefer not to go down that path tonight. And again, it's just out of respect for the individuals who are involved in this current situation. Governor, back to you.
Journal. Debbie Yetter from the Courier Journal. Debbie, you with us? All right, we'll come back. We'll make sure you're included. Kristen Shanahan from WDRB.
Hi, Governor. This is kind of a three-part question, but it's all on the same topic. You said that by April 12th, anyone who's 16 and older will be eligible to get their vaccine. Do you think that the state will have enough supply by then? And do you think it's going to be difficult for people to get appointments? And do you think it's possible that by the end of May, everyone who wants a vaccine will have at least gotten their first dose?
I think by the end of May, every Kentuckian, every adult Kentuckian, let me start again. I think by the end of May, every adult Kentuckian 16 and older who wants the vaccine will have received their first shot of hope. The projections that I have seen of supply coming from the federal government make that more than possible. And that's based on a significant portion of the population wanting the vaccine. As for opening up to everybody on April the 12th, I think on April the 12th, it will be hard for everybody to get an appointment at that point. But I believe that all of them will be able to get it by May 31st. So it's a good point. I hope people, when going into thinking about that first, are excited and want to sign up, but know that there'll be a big push for that starting date, but also know in the next month and a half from it opening up to everybody that there will be appointments available. Now, Kristen, I will tell you that I hope to beat that April 12th date. That is a latest date for us, and we will continue to watch both the supply that's coming in and the demand. If at any point we think demand is getting too soft to use 90% of all of our doses in a week, we will continue to open it up more and more. But I believe every Kentuckian who qualifies, who wants the vaccine, will get it by May the 31st, and that is great news. Mike Valenti from WLEX.
Yeah, Governor, thank you very much. Good afternoon. How would you characterize demand right now? And is vaccine hesitancy more of a problem than it was, say, a month ago? Are you noticing vaccine hesitancy amongst a specific group within 1C? I asked that because the Lexington Health Department had hundreds of appointments left for Wednesday, and they're asking people very strongly to get the vaccine.
Well, what we're seeing is in different places and just at specific times that there may be some extra appointments out there. One thing that we need to do better is point out when there are those extra appointments because there's a lot of people that want them. Now, we have now vaccinated 1,080,000 plus people. So there's going to be less demand at the moment because 1 million people have already gotten that first dose. So the total universe is shrinking. And as that universe shrinks, which we want it to, you're going to see more hesitancy because you're going to be getting closer and closer and closer to the group out there that is still concerned or questioning. And when we expand the different groups, we'll also impact that. So if there's a certain amount of hesitancy in 1C, which I think you had good insight saying that there is hesitancy inside these groups too. We've got to open them up at the right times to continue to fill these appointments. So that's why it's really important that providers know that they can step down a level to make sure they hit that 90% in 1 week. I don't think we're seeing hesitancy in one particular group. I just think that as more people get vaccinated, we'll reach the people that want more information. Again, as we open up new categories, I think you'll see a rush, and then we'll start to see more of that hesitancy in that group. We got to address that. We need everybody to get this vaccine. I do think that there is a natural positive pressure about the things that you can do if vaccinated and everybody else getting vaccinated that I think is going to help us. So I'm still very positive and optimistic about where we're going to get. That doesn't mean we don't have to be smart and put in the work. Tom Latek from Kentucky Today.
Thank you very much, Governor, and good afternoon to you once again. With the relaxation of the bar and restaurant rule, allowing them to open up until midnight, are you giving any consideration to reopening some of the outdoor activities that have been that were curtailed last year, like adult softball and different things along those lines?
Yes, and a lot of those activities, depending on how they do it, people can do. We're watching both cases and vaccinations and CDC guidance, right? Which we're all waiting for more of it. And we're waiting for it on travel, for instance, to try to give people the best advice that we can. Certainly on things like adult softball, space out, wear your mask to it, be careful, and those are activities that, if done right, can be done safely. What we're really trying to dig down in right now are our festivals and those types of activities that we all want to get back to. But the rate of vaccinations is really important to get in there. When kids are going to be eligible, where our cases are as of that moment. And so what I've told some of our local leaders is we're going to give you the advice, but if you can give us just a couple weeks with how fast things are moving, I think we can give better advice. Thinking that we vaccinated 80,000 people since Monday morning. And at the same time, our positivity rate is as low as it's been since July. And if those continue, we're going to be able to do more this summer. I certainly think we're going to be able to do a lot more than initially discussed by the president of small groups on the 4th of July. We're going to beat that by a lot. But I think they know that too, and we look forward to learning more as we go. Bruce Maples, Kentucky Health News, and I greatly appreciated Bruce's point about all the other teams in the NCAA tournament. So thank you.
Thank you, Governor. We've gotten some anecdotal reports of vaccine sites opening up to more than even 1C because they didn't have enough people making appointments. So how many of this month's vaccinations do you know of that went beyond Category 1C? And does the state have any graphic or tabular representation of this problem that it can share with us?
Bruce, while we track the demographics, we could show you age. What we can't pair it up with, and I think it would be difficult under privacy laws, is how many people who are, say, 40, who got the vaccine last week, have one of the conditions in 1C. So we don't have to my knowledge, a specific tracker of every time a provider needs to hit that 90% mark in a week and dip down. And remember, they did this with 1B too, and we're dipping into 1C. So that's what we're seeing. We're seeing 1C dipping down further. And that's one of the reasons we're opening it up to individuals 50 and older, starting next week. Again, it's suggesting we're moving there. And those that still have a large population in 1C ought to continue to prioritize it. It's certainly happening. We don't think it's happening on a huge scale when you look at 108,000 doses coming into to the state program. The other challenge, and it's a good thing, but it's a challenge, is how many different providers we have. Federal pharmacies, federal community health centers, DOD, and the VA that are operating on a different schedule. But while we'd like for everybody in 1C to get it first, if people are dipping down because they want to get everybody vaccinated, it does get us to herd immunity a lot faster. John Charlton from WHAS.
Thank you,
have John?
Governor. Hope all is well with you. Yeah, can you hear me?
I can.
You got me? Okay, great. I got 3 unemployment questions. Hopefully the answers will be pretty easy. I'm asking on behalf of Ben Isaacs, who had a phone appointment earlier this month. Nobody called, nobody emailed. He had his phone with him the whole time. And he expected that there would be a follow-up after his missed call, explaining that they're going to reschedule, but nothing happened. So he had to schedule again next month. Is there anything that UI can do for people like him who were there for their phone call, but it didn't happen, instead of having to reschedule for several more weeks down the road? Number 2 is substitute teachers had reached out to us earlier in the pandemic, and they were filing for unemployment. And then they received letters saying they were overpaid. Are they going to be included in this group that can appeal and get a waiver? And third, ID.me, is that up and running? And if not, when's it expected to be up and running for the ID verification server?
I'll mention just the first one, and then I'll kick it over to Amy. One challenge in answering questions about specific individuals is, number 1, not being able to look at the claim before the question and know the details. But number 2, because of privacy concerns, we can't give certain information on them. So I was asked, and I won't say the time period, it could have been a couple of weeks ago, by a different reporter, John, about a specific individual and not being able to get this or that. Well, as it turns out, that individual doesn't qualify for unemployment under federal law, but not being able to respond to that question in that individual makes it tough. Now, with that said, we want to contact Mr. Isaacs or anybody else who had an appointment and didn't get it done, and we'll want to fix that. So with that, I'll kick it over to Amy.
Yeah, and I'll address the other 2 questions. With regard to substitute teachers, yes, if they received an overpayment, they will be eligible to ask for a waiver, just like anyone else with an overpayment. ID.me, I think it was going live this week. I don't have 100% confirmation, but I can check and we can get back to you with the go live date on that if it's not already up.
All right, Ryan Van Velzer from WFPL.
Thank you, Governor. The CDC is reporting at least 6,483 COVID deaths. So what's the discrepancy there between what you're reporting? Also, you said that at least 200 of these additional. How are those death certificates overlooked? And finally, death audit or whatever report there was to explain what with the audit. Would you share something like that with the media?
Well, we're still working on for that period of time. Is listed on a death certificate doesn't mean it. So, for instance, there are case associated with that individual. There are list other causes of death too. Ryan, times rightfully so, by the media and by legislators about how strong is your process to assure that you're not fear mongering or pushing out deaths that aren't COVID. And we made the commitment that we were going to go through every single one and put them through our committee or put them through the process. Certainly, we've relied primarily on what's come up through local health departments, but this is a second way to do that check. Our commitment, though, is we're going to count for all of it. We want to get it right. And that means not understating, but it also means not overstating. It's about getting it exactly right. And other states are going to be doing what we're doing. Most of them haven't yet. We're willing to go ahead and do it. But I also think it's going to be years and maybe even a decade before we know the true toll. What about those homeless who died, those who passed away in their home? What about the complications of COVID that we don't know yet? What about the long-term complications that could cause death further down the line? So we want to make sure that we get it right. This has been a period of such profound grief and loss. And we want to make sure we get it right, because when there are families that don't believe their family member died of COVID, they go through a difficult time. When there are family members who do, and it hasn't been listed the same. So again, we're going to continue to work to get it right and to try to be as transparent about the process as we can. Just like Indiana said, this won't be the only time we go back and do this. We're going to keep doing it and keep doing it and keep doing it. And that means there'll be times where our numbers increase 100 or a couple hundred. There'll be times in the future where we think we're done reporting, where we will continue to do it. But we've got to make sure that number one, if it's on the death certificate, there's a positive case associated with it, and then look at the documentation to make sure that that positive case is associated or closely associated with the date of death, because there are folks that have passed away from other things that survived COVID. Then for those that don't have a positive test, you got to get the other documents to look at, was this a COVID death? Do we believe that we can say that even without ever having a positive test there? So it's not simple, and that's why the people are trying to meticulously go through it. But again, we'll continue to provide this information. Y'all keep asking questions, and we'll try to give the best explanations, but also the best information where long-term we get it right. Debbie Yetter from the Courier-Journal. Okay, let's go over to Amy, who got an update on the ID.me question.
Yes, and sorry, John, that I didn't have that at the top of my mind. That hopefully will be rolled out next week. It has been slightly delayed because of the programming necessary for the extensions that were granted under the recent American Rescue Plan that re-upped PUA and some of the other pandemic-related benefits. We wanted to make sure there was no lapse, so we turned to that programming, and now they're turning back to finishing up the ID.me portion. So we should have that next week.
All right, I know Debbie's trying, so let's give her one last opportunity. All right, if you want to send us, Debbie, your questions, we'll make sure we get responses. All right, everybody, that's it for Thursday. I know a lot of information, a bunch of really new big sites coming up. I hope you're excited that 50 and older starts on Monday, and then April 12th, open for everybody, though I hope we beat that mark. If you have been vaccinated, remember, you have a special duty to those that haven't. Wear your mask, practice social distancing. Don't give up yet. Don't engage in those risky activities, because we got to make sure everybody gets to the finish line with us. Remember, everybody counts. Every single person counts. That's why we're going to do this COVID memorial. It's why we're going to make sure that we fully account for the tragedy that we have endured, and it's why we're going to vaccinate people as fast as we can. We'll see you back on Monday. Thanks.